A peptic ulcer is a disorder in which some open sores develop in the inner lining of the stomach, or duodenum, the first portion of the small intestine. This condition is developed due to a bacterial infection that affects the internal protective lining of the digestive tract. People who regularly use pain relievers or anti-inflammatory drugs are more likely to be affected by this disease. Indigestion, which includes various conditions such as nausea, bloating, and discomfort in the abdomen, is the main symptom of ulcers. Peptic ulcers usually have two types: gastric ulcers and duodenal ulcers. Peptic ulcer disease usually affects almost 4 million people throughout the world. Its prevalence rate is about 5% to 10%, according to a general report. If you are affected by this disease, your healthcare provider can determine its presence by examining the symptoms. If ulcers are not examined and treated on time, they could lead to serious problems, including bleeding, perforation, and others. This could be treated easily with medication at an early stage. In this video, we will explore the symptoms, causes, and treatment of peptic ulcers. What is meant by peptic ulcer disease? A peptic ulcer is a digestive tract disorder in which an injury occurs as a sore in the lining of the stomach or the small intestine. That's why a peptic ulcer is also known as a stomach or gastrointestinal ulcer. As the stomach is the main part of our digestive system, it produces acid and some enzymes to break down food, and its internal wall has a thick mucus lining that protects the stomach from its acid. When the balance between the digestive juices of the stomach and acid is disturbed, it results in inflamed tissues or ulcers. Causes of peptic ulcer. Bacteria. H. pylori. The main cause of peptic or stomach ulcer is an infection caused by the bacterium Helicobacter pylori. A report indicates that almost 50% of the world's population is infected with this bacterium. However, H. pylori has no negative impact in all these cases. It only causes an ulcer in 10 to 15% of people. It is contagious, especially in childhood. Pylori bacteria stick to the mucus layer of the stomach and cause irritation, which leads to the breakdown of that protective layer. This breakdown causes the stomach's acid to damage or eat the stomach's mucus layer, ultimately leading to ulcers. Pain relievers. Another major cause of peptic ulcers is the regular use of pain relievers and non-steroidal anti-inflammatory drugs, also known as NSAIDs. It does not mean that everyone who is taking NSAIDs is affected by ulcers, but the usage of NSAIDs coupled with H. pylori is most dangerous. Over 70 years of age, high dosage of NSAIDs, usage of corticosteroids, smoking, drinking alcohol, continuous usage of NSAID surgery, and other medications such as steroids are the risk factors that lead to ulcers. If a person already has a serious disease such as liver, kidney, or lung disease, they have a high chance of getting an ulcer. Zollinger-Ellison syndrome is a condition that occurs when one or more tumors cause the stomach to produce a large amount of acid, leading to a soring or hole in the lining of the stomach or upper part of the small intestine. Symptoms of peptic ulcer. A small ulcer may not show any specific symptoms of a peptic ulcer and could heal by itself. Bleeding is the main symptom of some ulcers. Pain in the upper part of the abdomen, an empty stomach after 1.2 hours of the meal, nausea, vomiting, chest pain, weight loss, fatigue, and ongoing heartburn are common symptoms of peptic ulcer. Complications. Internal bleeding. Bleeding can occur, which leads to blood loss or anemia, and the affected person requires a blood transfusion or regular hospitalization. This blood loss can lead to bloody stool or bloody vomit. Perforation in stomach wall. A peptic ulcer eats the stomach or small intestine wall and leads to an abdominal cavity infection. Gastric cancer. H. pylori people have a greater risk of gastric cancer. Peptic ulcers could block the digestive tract, which causes you to become full and leads to weight loss. Diagnosis of peptic ulcer. The healthcare provider can diagnose the presence of peptic ulcer just by talking to you and getting to know the symptoms of this disorder. If you are getting this disease but not taking NSAIDs, pylori could be the main reason for this disorder. If someone is experiencing severe symptoms of this disease, the doctor usually recommends an upper endoscopy to find the upper ulcer. In endoscopy, the doctor inserts a small camera containing a lighted tube inside the stomach through the throat to look for abnormalities in the digestive tract. Besides an endoscopy test to determine the main cause of this disorder, the healthcare provider recommends an H. pylori test. A stool and breath test are the easiest ways to observe H. pylori. An ulcer could be identified by imaging tests such as CT scans and X-rays. The doctor recommends that the patient drink a specific drink containing barium that coats the digestive tract, which enables a clear image of the ulcer on the imaging machine. Treatment of ulcer. If someone has a bleeding ulcer, your doctor can treat it by injecting medication during an endoscopy or using a clamp to seal that portion to stop the bleeding. Medications for ulcers include proton pump inhibitors and histamine receptor blockers. Both reduce acid production in the stomach by blocking the action of acid-producing cells. Do not use high doses of proton pump inhibitor as it may fracture your hip, wrist, or spine. Some antibiotics, such as amoxicillin and tetracycline, are also recommended by doctors to reduce this infectious disease. A patient is usually advised to take antibiotics for about 2 weeks. Some antacids may also be used to neutralize the stomach's acid production. Protective medications, like liquid bandages, can cover the ulcer and prevent further damage to the digestive tract. Prevention: remain protective against infection. H. pylori spreading evidence is not clear, but it could be transmitted from one person to another by eating raw or contaminated food or water. You can avoid it by washing your hands frequently and eating food cooked properly. Use the lowest possible dose of pain relievers. If you are using pain relievers regularly, then remain in touch with your doctor and ask him to use the lowest possible dose so that you can remain safe against pelvic ulcers. Avoid drinking too much alcohol. Quit smoking. Ulcers that cannot heal. The ulcers that do not heal even after treatment are called refractory ulcers. Reasons may include not taking medicine properly, some H. pylori being resistant to antibiotics, do not quit smoking, and regular use of NSAIDs. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.